Hi, my name's Ray Owen. I'm a clinical psychologist. I work mostly for the NHS in Herefordshire in the UK, where I specialise in physical health. Most of my work's actually in cancer and palliative care, and that's what I've done for most of my career. This is a brief narrated PowerPoint presentation on acceptance and commitment therapy, ACT, and it is a brief overview. Its main purpose is for those who either have done perhaps an introductory training some time ago, want to refresh their memory before going on to look further at the subject, or maybe you're about to do a training and would just like a quick look across the topic that might sort of prime them, familiarise them with some of the concepts before they begin. Acceptance and commitment therapy, often abbreviated to ACT but never pronounced as ACT, is sometimes referred to as one of the third wave of behavioural and cognitive psychotherapies, alongside other approaches such as dialectical behaviour therapy, the mindfulness-based approaches, mindfulness-based stress reduction, mindfulness-based cognitive therapy, and also compassion-focused therapy, though some would disagree whether it belongs in quite the same category. The historical background of ACT involves a range of people. The name most associated with its initial development is Professor Steve Hayes, alongside his colleagues Kelly Wilson and Kirk Stroessel, who's not shown here, but a whole range of other people you will come across, Robin Moser, Russ Harris, Johan Dahl, representing the big Norwegian Scandinavian influence on the development of ACT, and Kevin Polk here, who has worked a lot on an alternative way of presenting it to the one that you'll be hearing about today. Worth pointing out that quite a few of these people had a background in radical behaviourism, applied behaviour analysis, fundamental learning processes. That's going to become relevant. The starter position for ACT is a rejection of the concept endorsed by many of our cultures of healthy, happy normality. The idea that this is the default state of a human being, and any deviation from it is a sign that something is wrong. The reality that many of us encounter is people experiencing that they're not healthy and or they're not happy. So by that other assumption, they would therefore regard themselves as being not normal. And that doesn't fit with reality as most of us experience it. The major reason to suspect that that's false is simply the ubiquity of human suffering. The single most remarkable fact about human existence is how hard it is for humans to be happy. It was one of the lines from the initial major ACT book by Hayes, Stroessel and Wilson. There's all sorts of ways we could describe that widespread nature of human suffering. The high lifetime incidence of the big diagnoses one may make under DSM or other diagnostic criteria, if that's a way that you work. The fact that there's all sorts of needs for treatment and support from people who might not fit into those mental health categories. The fact that out there's high rates of divorce, sexual concerns, abuse, violence, prejudice, and that some extremely destructive behaviours are both common and aren't necessarily attached to some sort of syndrome. The most extreme example, I guess, being suicide. So what's the alternative assumption? Well, the alternative assumption is what's sometimes referred to as destructive normality. The idea that normal psychological processes that are working in the way that they're meant to often are destructive. And we need to understand these processes and work within them to promote health, whether that's physical health or psychological health. The culprit, according to ACT, is the system of normal mental representation and processing, which we, within this approach, often refer to more generally as language. And underpinning that, some basic learning processes, and one particular approach to that that's known as relational frame theory. Okay, go back to those fundamental learning processes. Functional contextualism is the underpinning philosophy, if you like, of acceptance and commitment therapy. This states that we can't understand, respond, or be helpful about a behaviour without knowing something about the context it occurs in and its functional consequence. The behaviour itself doesn't tell us anything of use. And within that approach, some of you may well be familiar with this, we tend to talk about ABCs, antecedents, behaviours, and consequences. An approach very familiar from fundamental learning theory and applied behaviour analysis. This is, of course, a development of Skinner's approach of radical behaviourism. Here's an example. Someone might experience feelings of anxiety and sadness, have thoughts like, I'm a loser, life sucks. They might be surrounded by environmental factors like a TV in front of them, a fridge full of beer nearby, and being alone. Those will, in this way of working, be described as the antecedents. And they were the antecedents to the target behaviour. The behaviour in question being the person trying not to think about it, watching TV and drinking large quantities of beer until he falls asleep, drunk. The consequences of that behaviour in the short term may well be relief from painful thoughts and feelings. Those would be the maintaining consequences. That would be why the behaviour was more likely to occur, because in the short term there was relief from those painful thoughts and feelings. However, in the long term, obviously it may lead to damage to physical health, increasing the emotional pain further. Relational frame theory is the model for how that kind of learning occurs in humans, how those relationships between objects, items in a person's world build up in the human mind during development and education and lead to a system of symbolic mental representation which we call language. In learning more about ACT, it's going to be really worth learning more about relational frame theory. However, that's as much detail as I want to go into for now. So the development of ACT really started, there's a lot of development work during the 1990s, but most of the work has been since Steve Hayes and his colleagues published their original book on acceptance and commitment therapy in 1999. Since that time, it's been applied across a huge range of problems and settings, and the list that's here is only a small subset. This is a scientific approach, often led by people with good research background, and therefore carefully evidencing the process has been very important. To date, there's well over 100 randomised control trials, as well as many hundreds smaller studies and case studies. There's been within that an emphasis on what's called mediational analysis, not just checking that there is a good outcome to the whole intervention, but checking that that outcome seems to be mediated by changes to the processes we think we're changing in ACT. There have been some problems with the evidence base, some of it from a couple of critical systematic reviews and meta-analyses, though some of that criticism may well come down to a fundamental difference in opinion about the relevance of diagnoses as a way of classifying participants, which is not something that happens within ACT and its related cousins. There's more recently been criticism that many of these studies aren't against what we call a strong control. For example, skilled cognitive behaviour therapy. Many of them are against waiting list controls, which is perhaps not unusual for a relatively young approach. However, that is an important factor. When a study is run against a very active control, like skilled CBT, what we tend to find is similar efficacy. It would be wrong to claim that there is evidence of systematic superiority of ACT over second wave Beck-Podesky style cognitive therapy, but equally the studies that have been done suggest that it is no less effective than that. Almost all of the available research and the evidence is available at this website, contextualscience.org, which is the online home of ACT and its related approaches. It's also worth briefly noticing that ACT has been accepted onto many of the evidence-based practice lists that develop, particularly in the States, where there is strong research support, particularly if it's used in chronic pain. not a specific topic we're going into today.